Of course, you know that climate change is a global phenomenon today, but many people have not been able to connect or to see the nexus between climate change and health. When you hear about climate change, what readily comes to mind is the environment. But there is an organization, a non-governmental organization, the Nigerian Health Watch, which has been trying to bring to the fore the nexus between climate change and health, giving climate change a human face, if you like. Of course, I do have the guest right here in the studio with me, and they will be helping us analyze all of the issues around climate change and health. So join me as I welcome now Kemi Sola Agbaoye, who is the Director of Programs, Nigeria Health Watch. Kemi, thank you so much for coming.
Thank you so much.
I hope I didn't bother your name. Agbaoye. I learned that a lot, but anyway.
No worries.
Let's see how it goes. Christopher Bassi is also joining us. He is the Program and Events Manager at Nigeria Health Watch. Chris, thank you for coming.
My pleasure. Thank you. Great to be here.
All right. So let me begin with you, Kemi. As I said in my intro, when people hear climate change, the first thing that comes to mind is environment, flood, and all of that. But people have not been able to connect the nexus between climate change and health. Any link?
Oh yeah, absolutely. So when you hear climate change, yes, the first thing that comes to mind is environment. But then we need to realize that human beings are the ones who live in the environment. So for every change that you see in the environment, human beings get affected. So for example, when there's a flood, human beings are displaced from their homes. This can have attendant mental health issues, anxiety, depression, as a result of losing your home at the flip of a coin, for example. When you hear that there's a drought, for example, as a result of climate change, what that means is that there isn't enough rainfall for people, for farmers, for people who work in agriculture to produce the food that we need to eat. So there's food security, which is a term that basically means that people are able to access good quality, nutritious foods for the entirety of their lifetime, the amount of food that they need and the quality of food that they need for their lifetime. But if agriculture is affected because of climate change, as is the case of drought, they can't produce enough for people to eat. That's one. When floods happen, infectious diseases spike, such as cholera, for example. Every time there's a flood in Nigeria, we see a rise in cholera cases. The recent flood that happened in Maiduguri, for example, we saw people being unable to access quality healthcare services. It's also one of the impacts of climate change, is what happens to the healthcare system as a result of severe environmental conditions. If there's a flood happening, a woman can't take her child for immunization, for example, in the primary healthcare centers. What that means is that child isn't properly protected from infectious diseases that affect children under 5. And this then means that those cases rise and you have more deaths. When there's a flood, you can't easily buy some of the products that you need. Speaking of menstrual hygiene, for example. When the flood happened in Maiduguri, we saw that one of the relief materials that were distributed were sanitary towels, because it's not easy to get those things in the middle of this. All of these things are examples of how climate change directly impacts health. Right. So there's food security and nutrition. When a person does not consume adequate food as needed for their growth and their development and their ability to function, then they start to go into undernutrition, malnutrition. We have cases of stunting, of wasting, which then predisposes them to infectious diseases as well. Infectious diseases also rise, cholera, malaria. People don't link climate change with malaria. When there's a flood, what that means is that you have huge bodies of water everywhere, which is a breeding site for mosquitoes. When a flood happens, water, sanitation, and hygiene facilities are affected. So you're not able to clean as you would. You don't have access to potable water, which means that you then are predisposed to a lot more mosquitoes biting you, malaria cases rise, cholera cases rise. All of these are essentially the impacts of climate change on health. So essentially, one of the things that the global community is doing now is emphasizing how climate health is actually the human face of climate change. If climate change is too abstract for you, if you're not conscious of the fact that because of climate change, rainy season is a lot longer than it used to be. It's still raining actively in October. This wasn't the case before. If those things don't connect for you in your thinking, in your day-to-day life, think about how it's affecting people's health and people's ability to access quality healthcare services, because it's two-pronged, and those two things matter.
Okay, so let me still stay with you. I'm aware that your organization works actively, to engage government and support government in raising awareness and increasing knowledge on a wide range of health issues. But this conference that you hold annually, by the way, I guess it would be right to say congratulations.
Thank you.
For 10 years. Really, it's not easy. But is it a way of also passing out this information, the connection between climate change and health?
Absolutely, yes. Climate change and health is, for the longest time, it wasn't a topical thing in this part of the world. A lot of the conversations about climate and health are held at the global level. Whereas in Nigeria, we are seeing the effects of climate change on us as a people, on population health, on our healthcare system. When floods happen, for example, you see that PHCs are, their buildings as well, they get submerged. So that significantly affects people's ability to access quality healthcare services.
So your conference is a way of also bringing this to the fore.
This was important because it's not very popular here.
Okay.
A lot of people aren't thinking about the climate health nexus in Africa, in Nigeria. That's one. Two, because you need to have these conversations in localized contexts with the evidence of the local community you're trying to have the conversation with. Right, so you need the evidence for that, for those people.
For easier understanding.
Yes, so it's not just the global evidence. It's not just what's happening in, say, the US or in the UK or in Sweden. It's what's happening here for us. If we don't have these conversations, we're not going to have our own localized evidence and localized solutions, because geographies are different.
Great. Okay, so let's come to you now, Chris. Every year you do this, and this is the 10th anniversary. Let's talk around your theme for this year, Future of Health Conference 2024, From Evidence to Action, Building Resilience at the Climate Health Nexus. Okay, Kemi had talked a bit about why you're holding this conference, but then tell us what this is all about and the plans you've got for this year.
Thank you very much. So as Kemi had mentioned, and you might be aware of, we've been doing this for 10 years. 9 years, this will be our 10th year. And so as much as possible, we have ensured that the theme of our convenings align with contemporary issues in public health at the time. Climate change is that hot topic in the public health space. And so just as Kemi mentioned, we're using this conference as a platform to really touch on that interlinkage between climate change and health, which in terms of local context, isn't as promoted, especially in this part of the world. So we've reached out we're going to be having discussions with experts in these spaces, from ministers to public sectors to private sector players also, implementation partners, and we've gone as far as even incorporating a youthful perspective to it. Given the fact that this is our 10th year, we thought what other time to unveil or debut our youth pre-conference, which is also aligned with the climate change theme. So the pre-conference is going to be a precursor to the main conference, where we intend to have youths who are essentially, and just for context, youths are the largest in terms of population demographics, nationally and globally. They are the largest. They constitute the largest in any population, and so it just means they are at the forefront, bearing the brunt of climate change and its impacts on health. But at the same time, these are the people leading the charge in terms of addressing climate change and its impacts. And so we're going to be having an event for them, curated by them for them. The theme for that event is Amplifying Youth Voices for Climate Action. And just so that this event isn't as stellar and unique as it is going to be, it's not one that will happen in isolation. We are going to ensure that insights from this particular event are translated into the main event. That's the Future of Health Conference with the theme From Evidence to Action, Building Resilience at the Climate Health Nexus. And so whatever insights are captured from this gathering of youths, talking about the challenges they face, first-hand challenges and strategies they have deployed as individuals, as groups, as collectives, translating all of this into the following day's events, essentially to guide the tone of discussions that will be had, because we're going to be having both events, as I had mentioned, key players, experts, from youths to policymakers, private sector players, implementation partners, and so it just ensures that in whatever discussions that will be had on the main event, this youthful perspective is captured, because you find out that from policy formation to implementation, a lot of the times there's usually that missing youth voice. And yes, we're called the leaders of tomorrow, but tomorrow has already come. And so there is a need to ensure that our perspectives, our voices, our inputs are captured in all these discussions that are going to be had. So,
quite a key point there for you to be captured. Yeah, some people will also ask, what of the women? Because that's another demography, that climate change affects a lot, even when you listen to Kemi from the analysis of the flood.
Yes. So on our event for the Future of Health Conference, we're going to be having and yes, for a fact, women are in fact affected by climate change, even more so than males are. And so for one of the sessions at the Future of Health Conference, we're going to be having a session that really calls that out. What are the issues these women face, especially pregnant women? What are these issues that they face, and what can be done to address this? That's for the main conference. For the youth pre-conference, same thing. We're going to be having researchers who are going to be talking on some of the studies they have conducted, which actually call out the fact that women, are more disadvantaged, especially in terms of the impacts of climate change on health based on physiological differences of the genders. And so yes, calling out the issue of gender and how climate change impacts gender is also a key topic that will be touched on both conferences on the day. So yeah.
Okay, so Chris, let's look at the outcomes, really, you expect to see from the celebration. It's a huge one for you because you're also celebrating 10 years of doing this. So what are the outcomes you expect to see at the end of the day? I understand there will be panel discussions, that will be delivered, keynote addresses that will be delivered by key and important people in society.
Yeah. So for both conferences, really, I think as Kemi mentioned, a key win for us would be policy reforms, policy implementations, because these conferences, both the Youth Pre-Conference and the Future of Health Conference, the main conference, would essentially shed light on that interlinkage between climate and health, which before now, as we had mentioned, wasn't really, common knowledge. And so it's what we expect from this is that our policymakers are able to either go back to the table, drawing board, and then look at the number of policies they have. What do we have that actually speaks